This training is all about the new DAC healthcare plan that we just launched that is now live. This is a co-op plan. It is not insurance. What is the good news for the business owner? Because we're all about serving clients, right? And our clients are the business owner and the business owner's employees or partners. So, number one, this is an ACA compliant plan, Affordable Care Act, Obamacare plan. There's some compliance requirements. If you're going to offer healthcare to your employees, it must have certain things covered. It's ACA compliant. Also, ERISA compliant. This is a retiree plan compliance where over 60% of the areas require a certain compliance if you're going to offer it to employees. That's just retiree protection. So that's ERISA compliant as well. ACA compliant means there's all the different benefits for the customer as well. You'll learn that after. Number three, they don't have to pay a portion of the premium. There is no premium, it's a member cost monthly, but if you're an employer and you offer health care to your employees, you have to cover half of it. So if you own that local landscape company, you want to offer health insurance to 50 people, all 50 employees, you got to cover half of it. Okay, otherwise you don't offer it, right? So what do most people do? They don't offer it and they leave it to the employees to figure out. And the employees can't get group discounts on their own. So what this does is allows the employer to offer without having to pay part of it. Okay, so now they can offer a group discounted plan without having to pay part of it. Now they're willing to offer this as a perk to their employees. Isn't that cool? So they don't have to pay a portion of it. And that's big for employees or employers who've thought about offering. Number four, there's a refund at the end of the year. If you have health insurance, you pay those premiums every year. The employer does and the employee does. And at the end of the year, if they didn't use it all, oh well, it's insurance. You paid for it. With this co-op plan, you're actually funding a claim fund that everybody puts money into that funds the claims of all the employees in the plan. And if there's any excess at the end of the year, if the whole group, the whole employer group, call it Joe's Landscaping as an example with 30 employees, all 30 are paying their monthly cost, they're funding that claim fund. At the end of the year, if they didn't use all those funds, it's refunded back to the employer to then spread back to the employees in the form of reduced rates next year, right? So there's a refund of any unused claims, but the next question is, well, what if it goes above the claims? There's reinsurance purchased on every one of these, so if it goes above the funded claim amount, the employer is not liable. So you can't have more. You don't have to worry about the funds, the claims going higher than the fund. You don't have to cover it, employer. But if the claims are under the fund, you get returned money back to you. Is that cool? Doesn't exist in the insurance world. And number six, we have an expert team who will handle and communicate to all your employees. They answer their questions, promote the plans, etc. Do a presentation for all of them to come to and learn about it, ask questions about their plan. Okay, and then when it goes live, each one of your employers will have a portal they can log into to see their doctors, to see their plan coverage, all that. If they have questions, they can go right to the plan coverage. They don't have to come to you as the employer, a personnel department. You don't need it. It's all handled off-site by our expert team who we partnered with, okay? The SBA co-op, all right? And Free Market Administrators is actually the group that handles all the customer service post sign up. They get a portal, all the doctors are listed, the pharmacy coverage is listed, just like with an insurance plan that you would expect, even though this is not insurance. So, business owner benefits are huge. Can you see how a business owner out there who wants to be a great employer today is not offering health care to their employees? Number one, because they'd have to cover half of it and they just can't afford that for a lot of their workers, right? Or number two, they don't want to do it because the costs are so high. So it's either you want to provide it, but the cost, so you can't afford it. So we can allow them to afford it because they don't have to pay any of it, although they could. And it's much lower monthly cost if they do want to cover it all. So employers love it. These are the benefits to the business owner. Now, let's look at the client themselves, the members. What do the members get? Okay, the members, first of all, they have a low monthly cost, far lower than insurance, okay? $1 coverage. There's no deductible that they have to meet before they start getting coverage. Okay, most plans out there, 500, 1,000, 6,000. Mine's 6,000 on my plan. My plan I had when I was self-employed was a $12,000 deductible, where my family and I had to have $12,000 of coverage before the insurance would cover anything. yet I was paying over $1,000 a month for that coverage, right? So no deductible on this, $1 coverage, it's co-insurance, they share in it. Because it's ACA compliant, you get all the preventative care visits covered. You don't even have co-insurance, you just have a copay of $20 on that. They give all of it's covered except your $20 copay for things like physicals, pap smears, flu shots, immunizations, the standard things you go into once a year for your physical, right? Those are preventative care, are covered at 100%. It's not even co-insurance. You just have to pay the $20 copay. Most insurances have this. That's what most people use only. Most people don't need all the other stuff, but it does come with a discount pharmacy plan and discount dental plan. It has a 24-hour telemedicine where you can talk to a doctor 24/7 from your home for convenience. Okay? No pre-existing condition limitation, so you can't be rejected because you've got a pre-existing condition. All right, isn't that cool? Where that's not the case with others. I already said it's ACA compliant, but it's a PPO network, meaning there's with over 4,000 doctors and hospitals, meaning PPO network just means the prices have already been negotiated for what that doctor can charge you for that service. So if you have a surgery, you want to have a shoulder replacement or a shoulder surgery, you've tried nutrition, didn't work for you, whatever, you had an accident, you got a crushed shoulder, whatever, you got to have surgery. Well, if you go in as a cash buyer, you're going to pay here. The PPO network may have negotiated here. See, so now you go in because you have this coverage, you're only paying this amount instead of this amount. This is all you're liable for. Because you have this plan, co-insurance, 50% is covered by the provider and 50% is covered by you. Okay, so you're going to have cost if you have outside of preventative care needs. You're going to have costs just like you would if you have insurance. If you have outside preventative care needs with insurance, you have to pay all of it up to the deductible. Here, you're paying 50% up to your coverage limits. And we have 4 different plans. Okay, 4 plans. The least expensive to the most expensive. Obviously, less coverage, most coverage. They cover the same things, but the lower the price plan, the lower your maximum coverage is. Okay, so if you want more coverage up to a higher and higher and higher amount, you pay more per month. If you don't need all that, if you're just more concerned about having your preventative coverage and having a low monthly cost and having 24-hour medicine, no pre-existing ACA network, you choose the lowest price plan. Okay, so the members pleased with a great plan, the business owners pleased with a great option they can provide people, very inexpensive. A lot of business owners have no coverage themselves and they'll jump all over this.